Heart disease is the leading cause of death for people in the United States. 69% of adults who have a first heart attack have high blood pressure. 77% of adults treated for a first stroke had high blood pressure. 74% of adults with congestive heart failure had high blood pressure. And 71% of adults with diabetes have high blood pressure. One thing all of these statistics have in common: high blood pressure. You might think this information applies more to men than it does to women, but women exceed men in dying of heart disease each year. Fortunately, women can take steps to lower their blood pressure by understanding how one critical organ can make the difference in protecting them from heart disease. Our hearts are at the center of our cardiovascular systems, but there is another organ that actually regulates our cardiovascular health. This organ is called your endothelium. It's the largest organ in your body, equivalent in size to approximately 6 tennis courts. Your endothelium is only 1 cell thick, and it lines the inside of your heart, arteries, and veins. Your capillaries are just extensions of your endothelium. Research over the last decade has shown that the endothelium is a multifunctional organ. One of those functions is to convert the amino acid L-arginine into nitric oxide. This is so important to your cardiovascular health that the 1998 Nobel Prize in Medicine was awarded to 3 American researchers who discovered how your endothelium converts the amino acid L-arginine into nitric oxide, the master signaling molecule for your entire cardiovascular system. Cardiovascular issues such as controlling blood pressure, preventing blood clots, and reversing endothelium cell dysfunction can be solved by nitric oxide. Nitric oxide can help control your blood pressure by causing the smooth muscle of your vascular wall to relax, which helps to keep your blood pressure at a normal range. Nitric oxide can help prevent blood clots by keeping blood platelet cells from sticking together. This can reduce blood clots, one of the leading causes of disability. Nitric oxide helps repair damage done to the endothelium and keeps it free from plaque formations and calcification, reversing endothelium cell dysfunction. This means a healthy endothelium equals a healthy cardiovascular system. The health of your endothelium is in its ability to properly produce nitric oxide and potentially reduce your risk for high blood pressure and other cardiovascular issues that have shortened the lives of so many women. Just imagine taking one small step to reducing your risk for heart disease and how that could impact your family and community. Apply nitric oxide therapy to your daily routine. Increase your levels of nitric oxide to take advantage of all of its cardiovascular benefits. If you're interested in learning more about nitric oxide therapy to lower your risk for heart disease, request our resource guide.